Good afternoon, good morning, good night, depending on where you've joined us from. Um, Today, we're having a regional webinar, and the reason why we're doing this is because there's a lot of discussions around GC8. And if you have been listening from last year, December, there's been a lot of information sessions. We've had, I think, two from the Global Fund. Do not worry, there are more to come all through the end of March. So that detail also will be shared as we proceed. Today, we're talking about what's new towards Grant Cycle 8. We're just trying to unpack the guidance with communities. This is a community led, it's for communities and civil societies. So ideally, this is for you. That's why I insisted at the beginning that use the Q&A chat function so that we can keep track of the questions that you have. My name, of course, I'm Miss Lizzie Otai. I'm going to be your co-host today, but I'm going to hand it over to our Learning Hub coordinator, Lisa, later on. But it's my pleasure to introduce today's discussion on behalf of course, the Anglophone Africa Regional Learning Hub, but also there are the learning hubs that we've partnered with. So this is from Francophone, LAC, Asia Pacific, MENA, and EECA. First of all, Happy New Year. I need to start that. Despite a lot of information going to be shared, we're meeting at a critical moment in global response of HIV, TB, and malaria. Now, for Grand Cycle 8, unfolding against a backdrop of, it's tightening global health financing, rising domestic pressure on health systems, but also just the growing uncertainty about the future of external support. Do not worry. For many countries and communities, the question is no longer just about scaling up, but about how to protect the gains that we've won all through the years. How do we sustain life-saving services and ensure that the people most affected remain at the center of decision making? And that's the reason I keep on insisting. This is for communities, this is for civil societies, this is for you. And as outlined in today's discussion, we're going to look at sustainability and transitions, and we're going to look at GC8 as an opportunity. It is the cycle through which the Global Fund from 2023 to 2028 strategy, fighting pandemics and building a healthier and more equitable world, can be accelerated in practice. This entails integrated approaches across the three diseases and stronger investments in community systems, a clear focus on equity, gender, equality, human rights, domestic resource, you name it. There are a lot of words that are going to be thrown around, but ideally we know that integration is one key term that we need to insist on as we go forward. But none of this will happen automatically. It requires early, meaningful, and sustained community engagement. And if you know the learning hubs and if you know ENS in general, for us, inclusivity and having community at the table with it through the whole step of GC8 is crucial. Now, today's webinar is designed to create space for exactly that. Beyond understanding what is new in the GC8 guidance, we will hear how communities across regions are preparing to engage. But before we start that off, thank you very much for creating time. As you can see, we have a list of amazing speakers covering all the regional learning hubs areas that I'd already mentioned. And briefly, this is how the rundown is going to be. So we'll start with welcoming remarks, opening remarks. There is presentation from the Global Fund, of course, because we're talking about GC8, but we're also going to have a Q&A session where we want your questions. I know through the information sessions, not all questions are answered because of time. That is why the learning hubs will be picking up those loopholes that are still existing. We'll be looking at community engagement in GC8 planning, resources and tools, and this is very crucial as we proceed with GC8, but also another round of Q&A just to see whether we're all on the same page. And do not worry, if this is a short period, you can reach out to the learning hubs. And that's why we have a session just for the learning hubs to like reintroduce themselves. And you can reach out directly to them to have a side session in case you still have more pending questions. We're trying to eliminate any aspect of misinformation and disinformation. And there's a lot of information circulating. We just want communities and civil societies to be on the same page. Next slide, please. That's my colleague Richard on the other end, just helping out. Of course, we've been through this so many times, but this is the first official webinar we're hosting under the Anglophone Learning Hub, and we're super excited. But you know the rules. Be on mute. Rename your account. We'd like to address you the way you feel comfortable. So just rename your account so that we know who you are. Network. These are the opportunities that the learning hubs are presenting. In case you missed the actual GC8 information sessions, we're trying to make sure that you get connected with the right people. So use the chat options for comments, but I insist your Q&A options should be used just for your questions so that we make sure we address every aspect of questions that come in. Respect each other's input. In civil societies, we always respect each other's input, but we also want you to just ensure that if there's any gray area, any room for questions or something that wasn't clear, we'll try and clarify it here. We're going to record this, of course. We already hit the record button, but we will share this later on after we're done. And use your electronic hand to request for a chance to speak. I've seen there's already somebody who has their electronic hand. We'll come to you during the Q&A bit. Next slide, please. Of course, you know why we're here. A lot of information around GC8. So we're trying to understand the shifts. There's a whole new modality. There are rules and there are also timelines on what is going to happen as far as GC8 is as the year progresses. Now we're also going to learn how communities can engage, influence, funding priorities. This is for you. So any question that you feel like, you've been holding on to it because you didn't get a chance during the GC8 information session, please feel free to drop them here. We're going to also look at exchange of best practices, lessons learned. We know how communities need information to further their advocacy efforts. So this is where you're supposed to be. Now we're going to also present an overview of what resources are available. We might skim through, but if you need a session where you deep dive into it, that is why we have the learning hubs here. Now we have over 400 people on this call, and that might be, the time might not be enough, but be rest assured that's the reason why we have the learning hubs, so they can even go back and have a tailored regional discussion if need be. Next slide, please. So this is where I introduce, she's a familiar face, a friend of communities and civil societies. Last time I saw Maureen were at ICASA last year in Ghana, which was an amazing session, just looking at the 3D season and just trying to figure out next steps for communities. And if you've seen or you've bumped into Maureen, she's very bubbly and very passionate about giving back to communities, but also representing the voice of communities. Maureen, I'm hoping that the jollof rice you ate, you're still not in Ghana, I'm hoping, and you're back home. But if you're still in Ghana, welcome. Maureen is also the community's delegation voice to the board of the Global Fund, and we really do appreciate what she does for communities. So, Maureen, I'm just trying to see if you're on the call, if you could have your camera on, if it's not going to be a lot of a hassle, so that we can officially kick off. Let us know when we're talking about the turning point for GC8 in the Global Fund strategy. What does that look like? Over to you, Maureen.
Thank you, Lizzie. Can you see and hear me?
I can see you. There you are. Happy New Year. And over to you, please.
Fortunately, I came back from Ghana.
So I missed the jollof rice.
Yeah, so thank you so much for this opportunity, and thank you to IANASO and other regional hubs for bringing us together. This is really, really important. So good morning, good afternoon, good evening, colleagues. Happy New Year. I'll begin by saying that we stand at a turning point, not just for the Global Fund, but for the communities who have been at the heart of HIV, TB, and malaria response. The reality we face is that Grant Cycle 8 begins amidst unprecedented challenges. The 8th replenishment fell short, and we all know about this, well below the 18 billion we needed, and further lower than the 25 billion required to stay on track towards the 2030 targets. So for the first time, Since Global Fund inception, we face reduced country allocations rather than increased investments. We are experiencing accelerated transitions. We have tighter timelines and growing uncertainty across the global health financing landscape. So numbers tell a very sobering story. 9.3 million people still need HIV treatment, with more than 1.3 million new infections annually. And we know that the 9.3 million people not on treatment are contributing to the new infections annually. TB modeling projects, an additional 1.7 million cases, 300,000 deaths, with worst case scenarios showing up to 10 million more TB cases by 2030. That is a tragedy. Malaria cases are rising, and we have also experienced issues of resistance, threatening to reverse the progress made pre-2000 levels. You know, what we did before 2000, that's where we are headed. And through it all, the systems that communities have built, the peer educators, the mentor mothers, the treatment literacy programs, the human rights defenders working in hostile environment, these ones also face greatest threat. So when we look at GC8, it's not a retreat. It should be a response. Let's look at it as a response rather than a retreat to the difficult landscape we are facing. It is not an admission of defeat. It must be a strategic response that protects what we know works while adapting new realities. The Secretariat has outlined 5 strategic shifts for GC8, and I want to speak on this from a community perspective. First, on prioritization and value for money. You know, when allocations shrink, the instinct is always to cut what seems extra. And too often, that means that community programs and human rights work and gender-responsive interventions face the cut. But this is precisely backward. Community-led responses are not luxury items to be trimmed in lean times. They are foundation for sustainable, equitable health systems. Studies consistently show that community health workers and peer educators, mentor mothers, peer-led programs reach the unreached and achieve better adherence and remove barriers to various challenging environments. Value for money cannot be measured solely on cost per outcome. It must account for who is reached, who is left behind, and whether the interventions address the structural barriers that perpetuate disease transmission. A cheaper intervention that fails to reach the criminalized population is not good value. It's a missed opportunity for impact. The second shift is on integration. We strongly support emphasis on integrating HIV, TB, and malaria services into primary healthcare systems. Communities have for a long time advocated for person-centered integrated service delivery. But integration must not become an excuse for marginalization. When services are integrated into systems that discriminate or criminalize or exclude, we don't improve access, we actually just relocate barriers. So integration must be accompanied by a robust community-led monitoring to ensure that key populations, adolescent girls and young women, and other marginalized groups can actually access the benefit from integrated services. Community systems must be integrated alongside disease services, not dismantled in the name of efficiency. The third focus is on most at-risk population. And this shift acknowledges what we have known all along. You cannot end epidemics while leaving the most affected behind. The technical brief on reducing human rights and gender-related barriers must not be treated as an optional guidance. In many high-burden settings, these interventions are the difference between success and failure. So we need GC8 to protect and, where possible, expand investments in programs that address stigma, discrimination, punitive laws. We need legal support services. We need stigma reduction programs and safe spaces for key populations. These are not add-ons. They are the prerequisites for epidemic control. The fourth shift is on sustainability and transition. And here is what we must speak most directly. The Global Fund sustainability approach in GC8 must recognize a fundamental truth. You cannot transition services to governments that criminalize populations who need them. You cannot expect domestic financing to replace Global Fund support for community-led monitoring when governments see civil society as adversaries rather than partners. So progressive co-financing requirements are appropriate for treatment commodities and core health systems, but community system and human rights programs and interventions for criminalized populations require a different approach. So for this, we need mechanisms for direct funding that bypass the hostile government structures. We need the communities, initiatives, we need regional platforms, we need explicit protection for community-led response and transition planning. So the language of self-reliance must not become cover for abandoning communities great at risk. And the fifth one on access to innovation, long-acting injectables for HIV prevention, new TB vaccines, improved malaria diagnostics. These innovations offer real hope. But hope deferred is hope denied. Access to innovation means nothing if innovations do not reach the people who need them most. We need GC8 to accelerate, not just regulatory approval, but community readiness, right-based delivery models, and equitable access for key population. Innovation without inclusion is just another form of inequality. So what does this mean for country dialogues? Because I know we are all preparing to have our country dialogues. These shifts will only succeed if country dialogues are truly inclusive. The compressed GC8 timelines make meaningful participation even more critical. CCMs must ensure that community representatives, particularly those from key populations and those living with diseases, have early substantive engagement in prioritization decisions. We cannot allow financial constraints to justify excluding community voices from the table. The TRP must also retain its independence and its mandate to raise concerns about human rights, gender equalities, shrinking civil society space, regardless of portfolio classification. So our responsibility as colleagues, we must acknowledge that it is a turning point. We cannot allow funding constraints to erode the decades of progress we have made, or to abandon the marginalized, or to treat communities as costs to be minimized rather than assets to be invested in. Or we can use this moment to recommit to the principles that made the Global Fund different and successful in the first place. We can ensure that prioritization is informed by community epidemiology, not just technocracy and desktop reviews. We can demand that integration strengthens rather than weaken community systems, and we can insist that sustainability planning protects rather than threatens programs for criminalized population. The communities we represent have survived far worse than budget shortfalls. We have survived AIDS denialism, we have survived stigma and discrimination, we have survived criminalization, we have built responses from nothing, sustained them through indifference, and scaled them despite hostility. We are not asking for special treatment in GC8, we are demanding that the Global Fund honor its founding commitment to put communities at the center. This is our turning point. Let us turn toward justice, towards equity, towards the promise that no one will be left behind. Thank you.
Oh my goodness, Maureen, it's always a pleasure having you just, kind of boost my morale in this fight. Ladies and gentlemen, when we started off, I wasn't so sure how it's going to pan out because, when you start talking about GC8, there are always a lot of technical issues and a lot of documents that you need to decipher. But as put simply in the words, this is a turning point. And that's the reason we started off with Maureen. Having, like powerful, committed voices who know that when they're in the, in the board and in the higher positions that they're holding, they're always looking out for civil societies and communities. It's always something to, kind of boost my morale. And I really appreciate your feedback. And ladies and gentlemen, as we proceed, my apologies, I forgot to mention this. I don't know why. I think I'm just super excited. It's a new year. We're talking about communities, but we're also having interpretation for this particular discussion. So if you've seen the globe on your screen, if you hit on that, you'll see we have French, Russian, Portuguese, Spanish, and Arabic translation. My apologies for not mentioning that. The reason why I'm reiterating this, it's because all the learning hubs are the ones running this particular session. And we want to make sure that we do not leave any sort of question behind and you do not feel like you missed any sort of discussion ongoing. Next slide, please. Thank you, Maureen, very much for that. I mean, I was scared when you started off giving out the numbers. 9.3 million people need services, 10 million people might be on the verge of getting TB by 2030. You said malaria cases. I was like, oh my God, is this how it's supposed to be going? But I like the way you did the whole turning point at the end. And now I feel like, I have this renewed energy. Ladies and gentlemen, before we start off, I'm going to hand it over. As I mentioned, I was just introducing the session, but I'm handing it over to, I know a lot of people have not met her, but this is a good opportunity to unveil the face behind the Anglophone Regional Learning Hub. And I have my colleague Lisa Marianne here. I don't know whether Lisa, you're on the call. Just trying to pin you so that people can actually see your face. Maybe you can. There you are. I'm going to hand it over to Lisa. Reason being, she's going to run with the discussion as we proceed until the end. And I just needed people to know who we have running the Learning Hub right now. Do not be fooled when she starts talking. She has a soft voice as opposed to mine. It's super loud for some reason. But her passion behind communities also welcome. And you'll definitely kind of pinpoint this one as she goes. So Lisa, over to you. Karibu sana. And I'm handing it over.
Thank you so much, Lizzie, and thank you for your energy. I don't know if I can match up to that, but thank you so much for opening this amazing webinar for us. And Maureen, just listening to you, I know everyone on this call is recharged. Everyone is bumped up for GC8, and all the communities are now, if they were not aware, now they are aware that it's not business as usual when it comes to GC8. So thank you so much for those amazing opening remarks. Now, moving on, and even before we begin to dissect how communities can engage, what are the opportunities, what are some of the risks, it's important that we get to really understand the overview of the GC8 guidance. I do recognize that some of us in this call were part of the kickoff webinar that took place in December by Global Fund, but now this is an opportunity to sort of like have a refresher for that and begin to translate that into how communities are viewing it and how we are preparing as communities. So I would like to introduce the next panelist who is going to be taking us through this session. Her name is Anna Malsen, and she is the current manager of the thematic cluster for key populations, community engagement, and responses at the Global Fund. Anna has been really integral when it comes to shaping community systems. And she has once also been a CCM member in her region, and she has supported 37 member states across Asia Pacific regions through her previous role with WHO in the Western Pacific Regional Office. She brings extensive expertise in primary healthcare, health system strengthening, disease control, and maternal and child health. Anna has also led teams and interventions when it comes to UHC and COVID-19 as an incident manager in Papua New Guinea. And she has led also cross-government coordination across health clusters. So Anna has also supported in the co-production of a TV series known as It Takes a Village, and she holds dual master's degrees in public health and applied sciences. Anna is deeply committed to health equity, rights-based approaches that center community voices in the global health governance and delivery. So with that brief introduction, you know for sure that the person coming in to share, to lead this session on timelines, applications, modalities, key shifts, and overview of the core guidance is the right person for you. Sorry, I forgot to introduce myself. My name is Lisa Marianne Mwangi, the Anglophone Africa Regional Learning Hub Coordinator. And with that, I do welcome you, Anna Malsen.
Thank you, Lisa Marianne. Really lovely to meet you. And also very hard act to always follow Maureen, who is always such a powerful speaker and always hits the points spot on. So let me take you through the presentation today. We're looking at GC8 and the materials and the funding request process. So I think someone can put up the slides. We can get started. As Maureen had mentioned, the replenishment outcome, we had 11.3 billion pledged at the time of the 8th replenishment, which is, you know, a huge global commitment despite the really tough fiscal climate that the world is facing right now. But it is below the 18 billion target that we needed to fully deliver on our ambition.
Yeah,
And
just give us 1 minute. Yeah, just 1 minute. Let's, Lisa, are we putting up the slides from our end? Sorry about that.
No worries, Lizzie.
But
Hey,
you can
Anna.
carry on. But, yeah. Sorry, Lisa. Oh.
I just wanted to request Anna to carry on as we try and get the slides behind the scenes.
Yes, thank you. We've got a lot to cover today. So I don't want to take up all the space for all the questions that will be there. So as you know, if we had reached our targets, a fully funded replenishment would have meant that we could save 23 million lives and prevent approximately 400 million new infections between the period of 2027 to 2029. So that really highlights the scale of impact that's at stake. This shortfall means that GC8 will have tighter allocations, and as Maureen mentioned, for the first time, we have to reduce the size of the allocations for countries. And that will require different ways of thinking, sharper prioritization, looking at where efficiencies can be gained, stronger alignment with domestic financing and system integration, and even in those constrained conditions, the replenishment outcomes does confirm the core strength of the partnership and sustained political backing for HIV, TB, and malaria. And I don't know if anyone was able to tune into the replenishment conference, but really powerful statements there from our partners and across the partnership in support of the work of the Global Fund, but also specifically in support of communities, of rights, of gender, and taking
Sorry,
action.
Anna, might you have the slides with you? We're trying to trace those. Sorry.
I can project, Lizzie.
Oh, okay. Perfect. Thanks. Appreciate it. Thank you.
Thanks, Annabelle. All right, so we'll skip through to slide number 3. Thanks, Annabelle. So overall, this means in that reduced fiscal space that the country allocations will be reduced. There will also be accelerated transitions. And in some countries and places, they will be the final allocations. So it's really critical to maximize outcomes through prioritization, integration, and focusing on the most at-risk populations, equipping for self-reliance, and expediting those access to innovations that Maureen mentioned before. So next. So I'll take you through quickly the overview for the GC8 funding. So the fundamentals of applying for our funding remain. It still has all those same steps that you are used to and have seen before, and that starts with the allocation letter. They will be issued towards the end of March, at the start of March, after our board meeting. So the board will be meeting from the 10th to the 12th of February, and those decisions about the amounts get made at that board meeting. So it's a really critical time period, the next few weeks internally in the Secretariat. Once those letters come out, that begins, or you can already have begun country dialogue for prioritization. The funding request submission, the TRP review for funding request happens, the grant submission, GAC review, final board approval, and then signature. All of this is happening in a much shorter time period than usual, so within a space of about 9 months, where usually those allocation letters come out just before Christmas the year before. So we are working on a much shorter timeline. Next. The eligibility for allocation, so lower income countries, lower middle income countries still remain eligible no matter what the disease burden is. For upper middle income countries with high burden remain eligible. Those upper middle income countries with low burden and not high no longer eligible, and high income countries are not eligible. But eligibility does not guarantee an allocation. And in GC8, some country components that have received transition funding or voluntary transition are not eligible for GC8, regardless of the disease burden or income. With a very specific reference for malaria, we may recommend that a country may be exceptionally eligible for an allocation in the event of a significant resurgence. And I think we are all aware of the very dire consequences at the moment for the malaria community, with significant reduction in funding overall, really having a significant impact. Next. So the allocation letters, which will come to your CCMs, identify and will have tailored messaging per country, but they will include the allocation amount plus the utilization period for that allocation. It will identify the application approach for the country. It will identify co-financing requirements, the aims of the allocation and any priority investment areas. Also, eligibility for catalytic investments or matching funds will be identified and noted in those allocation letters, and if there's transition pathways and timelines that are relevant to your country. So they will arrive to your CCMs in early March. Next. And then begins the process of country dialogue, and that remains mandatory across all Global Fund processes and is a core requirement for that it's inclusive, it is transparent, and this supports transparent funding requests and principal recipient selection. Inclusivity is non-negotiable. Governments, civil society, key and vulnerable populations, technical partners, and affected communities must be meaningfully engaged throughout the prioritization process and design. For GC8, that dialogue needs to evolve from not always being just disease by disease discussions, but also to take into account integration, prioritization, and reflecting the full allocation envelope and trade-offs across HIV, TB, malaria, and RSSH. And their focus must really help, and those dialogues must shift towards the highest impact and value for money, grounded in the EPI data, the service coverage gaps, and program evidence. A strong country dialogue should start with a shared understanding of a programming landscape. So what are you funding now? What's missing? Including the domestic financing, partner investments, and existing system capacity. A lot of that has changed in the last 12 months. So being really conscious of where those gaps are is important to understand for GC8, but also to avoid any duplication and maximize complementarity where possible. Context matters. The depth and the structure of the dialogue should be tailored to country readiness, transition risk, and the health system maturity, while maintaining minimum standards for transparency and participation. Effective dialogue is not just a compliance step, it is the foundation for country ownership, better prioritization, and more sustainable investment. Next. The funding requests in GC8, so we'll have the application package, so the funding request package, which tells the Global Fund how that allocation and how the country is choosing to invest those resources. They should be aligned with country processes, reflect national health strategies as expressed in costed and prioritized national strategic plans, informed by that country dialogue. For GC8, countries are required to submit funding requests for all eligible components at the same time, ideally as a single multi-component request. There are two types of funding request application packages. Those for high impact and core portfolios, they will have a full review, and that's the full package of materials for GC8, which is the form plus 11 annexes. We will be having more training on this from the Global Fund in January. And the second is for focused portfolios. This is transitioned and focused grants. The funding request package includes the form plus 9 annexes, and there'll be a training a bit later in March on that as well. So keep your eyes out for that. Next. For GC8, the funding request grant making submission pathways, we've been trying to streamline our processes and make it also faster, because we know time is of the essence, and often this process takes a very long time. So in situations, we will have the opportunity for what's called grant-ready funding requests. So if the CCM nominates a PR that is already a PR, they can include or request that they begin part of the grant level performance framework detailed budget as part of the application funding request submission. This significantly expedites our ability for grant negotiation, reduces manual work, and ensures that it's a strong early grant design from the start. So the eligibility for this is for applicants and that nominate existing principal recipients for all grants within the same funding request. And that early nomination of PRs is critical to enable this to happen. Otherwise, it's the normal and the usual way of applying for funding with a review by the TRP before negotiating grant level performance framework and detailed budgets. This requires rigorous funding request prioritization in case of changing a PR or significant changes to implementation arrangements or reprioritization happening nationally. For applicants nominating a new PR for one or more grants. So the usual process applies. Next. The technical review panel remains a critical step as part of our review process here. The TRP is an independent, impartial team of experts recruited to review those funding requests. They go through them very closely, and they're looking for strategic focus, technical soundness, potential for impact, and poised for sustainability. They also closely watch and look for all of our community rights and gender elements. Are they there? Are they missing? And the TRP will recommend for grant making, or they'll recommend for iteration. They also identify issues and actions that need to be addressed either during the grant implementation process or prior to grant signing. And they will also identify items that go into PAR or assessed as unfunded quality demand. It's a really important part of our process. Next. Then it goes to grant making after translating those funding requests into quality grants that are disbursement and implementation ready. The negotiations happen between the Global Fund and the selected principal recipient or principal recipients in consultation with in-country stakeholders. That needs to also include communities. The programmatic targets and budget are agreed upon, and the performance frameworks and budgets. And then that goes to GAC and signed by the principal recipient and CCM, and then eventually signed upon the board approval. Next. So let's take you through a little snapshot of what the funding request form will look like. Again, the Secretariat, based on feedback for GC7, has really strived to streamline the funding request form. It's had a significant overhaul, so it should be about 60% shorter in GC8 than it was in GC7. There are 4 key sections to the form: the country context and priorities, the funding request and rationale, the sustainability, domestic financing, co-financing and resource mobilization, and implementation. And as mentioned before, there's 11 annexes, of which the assessment of equity, human rights, and gender-related barriers to health services is expected to be there, mandatory for high-impact portfolios, if available for core portfolios. And the rest should look fairly familiar to those that have been through this before. Next. For focused portfolios, transition portfolios, again, significant work in reducing the form. complexity at 70% shorter than in GC7. There's just 3 sections in this form: the funding request and rationale, domestic financing, co-financing and transition, and implementation. 9 additional annexes are required there. And the assessment of equity, human rights and gender-related barriers to health service is encouraged to also be included if it is available. Next. Please go to our website. We have all of the applicant investment guidance uploaded online. You'll find all our core guidance, the HIV information note, TB information note, malaria, RSSH, the modular framework handbook, the integration technical brief. I'd also like to highlight removing the human rights, gender-related barriers to HIV, TB and malaria services technical brief. There's been a few changes in the modular framework for GC8. This brief for the human rights and gender also helps you navigate those changes and where they are to ensure that it's easy to use, and plus our procurement and supply chain, value for money, payment for results, etc. So please go online, download them. I know they're always complicated. We've tried again also to reduce the amount of pages for the investment guidance. So next. For the operational planning, next. This is what the year will look like. So we're here in January. We're getting ready for the board and getting ready for those allocation letters to be sent out in early March. Then, as you can see, from the time those allocations land in country with CCMs, that funding request development process plus TRP submission windows, the first one, 8th of June, 27th July and the 5th of October. So they're the key timelines. And then we go to grant making and submission to GAC at the latter part of the year, but also highlighting that GC7 implementation needs to continue. So it's going to be a busy year, and it's hard to keep that balance and focus when there is so much at stake for GC8. And then by the 1st of January, implementation for the majority of grants should begin. Next. And it's really important to consider as part of the agenda for GC8, accelerating integration to drive the impact and efficiency for HIV, TB and malaria services and RSSH, and how that's integrated within the primary healthcare system. Start those discussions now. It takes time, but also, please, not everything can be integrated. So remember, if it can't be integrated, it's okay to continue and to request for it in the funding request, but where possible and where it makes sense and where it's aligning with the integration approach in the country, then we support that, and that should be in the funding request. Assess the catalytic use and sustainability of global fund investments. So again, the financing landscape has changed. So how do we consider domestic sources of financing? We got the right first-line HIV, TB and malaria treatments, diagnostics, and synergizing those with other sources of finance and agreements, and trying to encourage simplification of implementation arrangements and how that can support value for money. Early selection of PRs, again, we're calling for, in case CCMs do and can do that early confirmation, that allows grant making to happen faster for GC8. Next. Here are the submission windows, so keep these dates front and center. For those very first countries intending to apply in window 1, that funding submission date will be the 8th of June with a TRP review in July. Second window, the 27th of July with a TRP review in September. And window 3, the 5th of October, and then November. Next. I think I'm going way over time. So just a reminder, the minimum expectations for community engagement remain. You will see that the funding request development stage, the community priority is annex that was there in GC7 is there for GC8. Please use it. It is important. In grant making, we're saying ensuring that access to timely information on grant negotiation status is really critical for civil society CCM representatives. And also across grant implementation, ensuring your civil society CCM reps are staying up to date and getting that information. Next. I'll just quickly go because we're ready. I think I'm way over time. But those minimum expectations, you can find that online, but it's to really ensure that there's an engagement roadmap, that there is access to 15% of CCM funding that allows constituency engagement and a submission pathway for all CCM members. The funding request includes the annex of priorities from communities. This is mandatory for high impact in core countries, and that country teams will assess the effectiveness of the country dialogue and have a fuller picture of community needs to extent those interventions are also included. It doesn't guarantee all interventions are included, but it is a good space to see the alignment and ensure that we can get as much support for those interventions as possible. There, that's the form. And I think I'll just wrap up there. The second minimum expectation as well, but we're running short of time. So thank you. Back to you, Lisa Marianne.
Thank you so much, Anna. That was very informative. And we do have a couple of questions that are in the chat box. I hope you're able to stick around for just a few 5 minutes to answer some of them. But colleagues, I'd like to invite you to share any questions that you may have in the Q&A chat box. We may not be necessarily have the time to invite all of you to ask the questions via the mic. So please, I'd encourage you to share your questions on the Q&A section. So Anna, some of the questions that are coming to you are, there's one from Peter Owiti. He asks, the GC8 is the most critical. Do we understand that it may be the last grant cycle, or shall we have grant cycle 9? And because most countries are expected to have already achieved their sustainable development goals by 2030. So basically, Peter is asking, is this our last bread?
Hopefully not, Peter. So, for some countries, this will be the last grant cycle, and those countries already know that they're on the transition pathway out of the Global Fund. But for some, this will be the second or third last grant cycle that will be expected as well. This is a lot to do with the transition of income status in countries as well as success, but also that with restricted resources, we'll continuing to focus the largest allocations on the lower income, highest burden settings, and ensuring that those resources are there in those situations. So we also really hope that the Global Fund continues to be supported past grant cycle 8, and we will continue to ensure that we do our best in fundraising to ensure the Global Fund continues. But this is the first time that we're having to come with reduced allocations as a part of a replenishment. So uncharted waters, but there's still significant support available. I think the other key message from the recent strategy committee, and that will go to board, is really around we need to really support and get intentional around what transition looks like. And that's why some of the co-financing elements, for example, are going to be really monitored more strongly, particularly in some of those upper middle income countries over the next grant cycle.
All right, thank you so much, Anna. There was a question around the windows, and Annabelle has been kind enough to answer that in the Q&A. However, I believe that Mr. Steve was asking this question, would want to know if there are other windows before the ones that have been announced for this year, the 3 of them. And then maybe just to add another one so that you can answer both in the interest of time. Karine asked whether pandemic preparedness is going to be a key priority for GC8.
Thanks. So the 3 windows outlined are the 3 confirmed windows. So there's no changes, there's no earlier windows. Otherwise, there's really not that much time to have the dialogue between the time the allocation letters come to country and the first window. So far, as we know, those three are confirmed. And then for PPR, yes, PPR remains very much a priority. But again, it's depending on what the country's priorities and needs are. So all of that good work and investments that we've made in PPR over the last in grant cycle 7, and with that additional work that and support we've had from the C19RM funding, what can be integrated, and some of the lessons that we've had from our own COPPA is about how we're integrating those lessons of PPR into national platforms, national engagement, community packages for PPR that can continue to be funded and supported. It's definitely still a priority, but again, what are the priorities? Primarily around HIV, TB, and malaria, and RSSH, and how PPR fits as part of that package.
Okay, thank you so much, Anna. Maybe just before we move on to the next session, I do see Natalie Ihemba's hand. It's been up for a while. Maybe we can invite her to ask you her question. Natalie, the mic is yours. Okay, Natalie, if you're not there, maybe you can type your question on the chat box. So just to really thank you, Anna, for taking us through this. And I believe that...
Sorry, Lisa, I think Watara's question might be for GF. So maybe we can get Watara to ask a question. Sorry.
All right, thank you, Watara.
Thank you, Anne, and then thank you for the presentation. I think this is well informative. A quick one, you mentioned, I don't know which track, but there is a fast approach where countries are eligible to use that fast approach. But I'm asking, in a case where countries trying to have a new PR, what happened, and they still choose the fast approach? What happened in that instance? What are the advice for countries who want to have a new PR and they still want to go with the new the fast approach?
That won't be possible. So if there's going to be a selection of a new PR, the usual standard process applies for applying. So you don't sort of have that fast track approach where you're doing the detailed budget and performance frameworks then and there as part of the funding request. So if a new PR is being selected, then the usual process applies, because that also requires from the Global Fund side additional reviews and assessments as part of that process.
Okay, a quick follow-up, please, if I may have a second. The reason I'm asking is, in some cases, CCM in part of our countries may want to proceed with the fast track approach, but community with experience would want a new PR. So in that instance where CCMs want to choose the fast approach because probably PRs wants to be maintained and they want to engage CCM for that reason, and the community wants a new PR. In that case, what happened in that situation, if you have some advice? Thank you.
A very difficult one. So in that case, it's really the CCM that's making those decisions around if a PR, that you should go through a PR selection process. So if there's dissent regarding the principal recipient and the performance and a desire for same, then the CCM members need to be raising that for discussion. And your civil society representative on the CCM needs to also be pushing for that. And those discussions can also happen together with the country team if and when they visit.
Okay, thank you so much. Anna, Watara, I think you have been answered. So in the interest of time, please, if you have any more questions, just share them on the Q&A box and we will respond to them there. And those that don't have been responded to, we do have another upcoming Q&A session. So as Anna, thank you so much. And I believe that you've provided so much clarity for communities, and now people are able to prepare adequately based on the guidance that you've provided. And I also believe that your presentation is available for community members to be able to reference even after this webinar. Now moving on, we will be going to a very exciting panel session, and it's basically around community engagement. This is where we get the opportunity to look into how communities are preparing for GC8. What is some of the feedback, especially after the December kickoff when the guidance was provided? What are some of the political realities that maybe could pose risk when it comes to meaningful engagement of communities in GC8 planning and processes? And for this session, we do have an exciting panel representing 5 regions. We do have Francophone Africa, we do have Asia Pacific, we have the Eastern Europe and Central Asia, we have Latin America, and we also have the MENA region. And before I invite our panelists, I would just like to encourage the regional learning hubs to please introduce themselves on the comment section so that participants can get to meet you. And also please share your contact details in case they would want to reach out to you directly. So I'm going to briefly ask our panelists to introduce themselves in the order that's on the screen. And we are going to start with Mr. Firinga Johnson. And Mr. Johnson, even as you introduce yourself, please share with us what patterns are being observed in the Francophone region, and in terms of how communities have interpreted the guidance and how they are preparing for GC8. Is there any certain level of anxiety? Is there pressure for sustainability, especially with the integration conversations that have been ongoing? Over to you, Mr. Johnson.
Merci beaucoup. Je m'appelle Johnson Firenga. Je suis directeur exécutif de l'ONG Réseau Madeds et je suis aussi une personne qui vit avec le VIH depuis 20 ans. Bon, par rapport à la préparation de GC8, comme vous savez que Madagascar a connu deux coupures pour la GC7. La première, c'est la non-signature, due à la non-signature de la lettre d'engagement de financement de compte partie. Et la deuxième, c'est par rapport au gel de financement, c'est par rapport au problème mondial. Donc, face à cette situation, nous nous organisons déjà au niveau du pays. On a mis en place déjà la fêtière qui regroupe toutes les organisations des PCPR et PVVIH. On a élargi ces fêtières pour faire entrer les autres OSC qui travaillent dans la TB et dans la PALU. Nous avons déjà préparé aussi des plaidoyers pour pouvoir mobiliser les ressources domestiques, y compris les secteurs privés, pour parler, pour anticiper qu'est-ce qui va se passer pour la GC8, souhaitant que nous arrivons à répondre. La GC8 n'aura plus la coupure, mais on se stresse déjà et on anticipe déjà pour éviter ce genre de situation. Et par rapport à l'engagement, la population, les organisations de la société civile a déjà demandé l'assistance technique au niveau de l'Expertise France pour nous aider d'abord dans la mise à jour de nos PSN, parce que nos 3 PSN, plan stratégique national, vont être à revoir, mettre à jour. Et nous avons aussi, dans cette même cahier des charges, on a demandé aussi à ce que l'Expertise France accompagne les organisations de la société civile jusqu'au grand making, depuis l'écriture jusqu'au grand making de GC8. Donc, on se prépare. Oui, le stress est toujours là parce que c'est pas facile d'organiser, de l'idée, comment dirais-je, d'accompagner toutes les organisations de la société civile avec les conflits de leadership, avec beaucoup de paramètres, mais on est là et on avance. Et on est aussi prêt pour étudier quelles sont nos stratégies à nous, pour nous, les organisations de la société civile, pour que le dialogue soit inclusif, participatif et que nous arrivons à porter la voix des organisations de la société civile. Et avec l'aide de Hub, je travaille aussi avec tous les points focaux, on se partage, on se demande, on se pose les questions et parfois on demande l'appui de aide d'apprentissage pour leur demander, on a rencontré telle situation, mais on avance. Donc, à peu près ça, nous sommes prêts pour faire face à tout ça et nous souhaitons que la participation communautaire, surtout pour les populations clés et les personnes vivant avec le VIH, soit vraiment effective et que nous contribuions comme un acteur incontournable, pas un adversaire, mais c'est un acteur qui arrive à apporter nos contributions. Merci beaucoup.
All right. Thank you so much, Mr. Johnson. Please stay in case a question comes up for you. So our next panelist who will be giving us their regional perspective is Cameroon from Asia Pacific. And Cameroon, welcome and feel free to introduce yourself. And even as you introduce yourself, please let us know what are 2 or 3 community concerns that you have come across in the Asia Pacific region, even as communities are preparing to head into GC8, and especially any gaps that may have arisen or that may seem as though they will arise when it comes to primary healthcare as well.
Thank you so much, Lisa. And once again, I'm so pleased to be part of this very important webinar, which is coming in at the same time of our plan that soon we will hope more from the Global Fund of how my organization and civil society here in the country can work together to support the planning, which is focused on ensuring inclusiveness, but also transparent. The 2 things that you just asked, what concerns us since we received the information concerning to GC8, and especially we know that the budget mobilization or replenishment could not reach the expectation. This is really a big concern, especially when it comes to the allocation for GC8 would be reduced. We heard probably around 30%. This is really really a concern for us to ensure how civil society community affected by the disease, can continue to play their role, especially for our case, to sustain effective response to both HIV, TB, and malaria. Within our region, just look at the 3 diseases. We still have seen the rising HIV infection, especially among young population. At the same time, we also have seen, if you look at for TB in our region, among the 8 countries that contribute to third of a TB burden in the globe, many countries within that is in our region, including, India, Bangladesh, Philippines, So this is really, concern us, especially when it comes to how can the the funding can support us. So we have India, Indonesia, Philippines, China, Pakistan, Bangladesh. So among the 8 countries, that account for 2/3 of TB burden is in our region. So this means that we expect that we need to ensure how we can support and we can work together with the government to to mobilize domestic resource to ensure that the integration really in reality, how integration should take place in an effective way to make sure that civil society and community, especially those affected by the disease, continue to play important role in monitoring the services, but importantly to continue to handle a certain aspect of services. Looking at the infection, like I mentioned, HIV and TB in particular in our region, the young people are still, they are the one that continue to have this kind of infection, and we know that young people like gay men, MSM, transgender people who use drugs, these are the people require peer support, require a lot of mental support, so that they can access to services and or get to services early. And these are the people that require a lot of support from civil society and affected community, their peer, to come on board. So when the resource is limited, that is our concern. But we hope that through country dialogue, we really want to see that the country put that as important and need to listen to what could be the priority that the community and affected the civil society would like to bring to the table and to discuss what can they do. On the other aspect, we really want to see when the resource become less, the social contracting where the government could find way of how the domestic resource plus together this kind of limited resource can work together to continue to have our engagement, because we still see that without having this kind of civil society and affected community on board in the aspect that I mentioned, in certain area where the government cannot do, civil society continue to do, like reaching key population, reaching key and vulnerable population for TB and HIV, play the role on monitoring aspect of services. That is something that is still very critical. And thanks so much to the Global Fund that put this as one of the, a core area of ensuring the country dialogue as well as the whole process with our engagement. So we hope that the technical assistance that will be provided by the Global Fund to support the process could come soon, and then we would like to see how we as civil society continue to build our engagement stronger, more effective, and how to work alongside with the government around the mobilizing domestic resources. So that is what I have so far, and I hope you could hear me properly. Thank you.
Yes, thank you so much, Shamron. And thank you for really giving us a detailed outlook of Asia Pacific, but also what it is that you're doing, including collaborating with governments. Please stay on the call in case there are any questions that are coming for you. And next, we are going to invite Ghana from the Eastern Europe and Central Asia. And Ghana, even as you introduce yourself, please share with us how communities in your region are protecting their priorities, especially when it comes to human rights. We have seen, the restricted KP space in your region. So how are they protecting their human rights, and how are communities staying true to their leadership and leading, preparing to lead the processes? Over to you.
Thank you very much, and I'm very happy that we have this opportunity to share between the regions. And I'm Hanna Dovba from Eurasian Harm Reduction Association. We are hosting Eastern Europe and Central Asia Global Fund Learning Hub. And for us in the Eastern Europe and Central Asia, the key, the discussion of Grant Cycle 8 is taking place against the really hard and crisis situation with the civic space. place in the region, and we have simultaneous processes of restricting civic space, restricting participation, introducing the so-called foreign agent laws in several countries, and in the same time reduced domestic and international funding, and growing political pressure on communities most affected by HIV and TB. And these realities fundamentally shape how communities can engage in the country dialogues and how effective global fund investment can be. For us, this is happening in the background of criminalization and stigmatization, which is worsening through and new legislation. We're checking and we are monitoring the legislative changes in all the countries of the region, and we see that every month in one or another countries we have new attempts to introduce war on drugs or introduce the so-called law against homo propaganda or against the gender diversity, and this affect possibility for organizations and for activists to take part in the dialogue, to openly cooperate with the governments, and actually this really more stigmatizing narratives, more limitations on funding access, and more direct intimidations for community leaders is faced in a lot of countries. Luckily, not all countries of the region, but that's the context we are living in. And for us as a regional learning hub, we are supporting civil society and community engagement in country dialogue processes. And it's already mentioned that there are opportunities to apply for technical support. And in the countries where the other technical support, in addition to Global Fund Strategic Initiative on Community Engagement, is available, we are trying to negotiate and to connect this requests and organizations and communities who need to be supported in their role in country dialogue to be fulfilled with all available resources in the region. And actually, we will have opportunity to support communities in participating in country dialogues, but also in learning from each other, because we are doing in-person regional meeting in March for community representatives in CCMs in several countries of the region who are applying for the first window to raise this understanding what should be priorities. And I need to highlight that even in the situation when the funding will be restricted, and for a lot of countries it will be the last grant or transiting grants, we still need to treat community engagement and community-led services as a core investment. That's some message we are sending to all our partners and all our community partners from regional key populations united around and coordinating our effort. We are trying from regional and local organizations to have the joint message that actually, without the communities, services for key populations, health and social services for key population will not be effective at all. And that will be wasted resources, not the value for money. And if we are speaking about integration, and decentralization of the services, that's also very important important changes which we envisage to see in the grants in the country, and that's very important to ensure sustainability of services, to have them integrated in the healthcare systems. But in the same time, it's not only healthcare, but it's community systems which exist, and they need to have community-led services integrated into the systems. And as for the sustainability and transition, yes, we see the cut in domestic funding during the last couple of years, and we don't expect that it will be easier to achieve. But again, together in cooperation with governmental agencies and with the Global Fund PRs and SRs, we could achieve this proper transition for specific interventions for key populations, for prevention, for care and support, and for treatment for key populations, whatever hard it is. But if we will prioritize it in the country proposals, then it could be done together. And what I need to say that there are plenty of innovations happening in the services for key populations in our region in Eastern Europe and Central Asia. And that's, we are speaking about the mobile vans and mobile providing services and digital tools for service provision, and all of this is done in cooperation with communities. So we sincerely hope that the priorities on decriminalization and reducing legal restrictions for the services, integration, transition to domestic funding, and overcoming the shrinking civic space, that will be in priorities for community and for countries in our region. And we are very much keen to provide technical support and capacity building for communities in our region to achieve this together. Thank you.
Okay, thank you so much, Ghana. That was very, very informative. And thank you for providing that context in-depthly, but also providing what are the potential solutions. I do recognize that we already have hands coming up with potential questions. So please just hold on to those hands. And if possible, also share your questions on the chat box. Our panelists will be answering some of them. So next, we do have from Latin America, Christian Acosta. And Christian, even as you come up to introduce yourself, please share with us, obviously the entire world to an extent has experienced the global shifts when it comes to health financing. So how have these global shifts shaped national health priorities within Latin America? What are some of the biggest risks that you have observed that maybe the other panelists have not mentioned? But also, what are some of the opportunities that you foresee where Latin Americans can take advantage of and utilize in the upcoming GC8 processes? Welcome, Christian.
Gracias, mi nombre es Cristian, soy parte del equipo técnico de Corporación Quimirina, una organización de la sociedad civil que trabaja en VIH. Bueno, en América Latina hay varias preocupaciones. La reducción y la incertidumbre del financiamiento en el contexto de alta volatilidad política. Muchos de nuestros países enfrentan asignaciones menores del Fondo Mundial, pero al mismo tiempo atraviesan cambios frecuentes de gobierno y reorientaciones políticas. Una parte creciente del gasto público se está dirigiendo a seguridad, especialmente a la lucha contra el narcotráfico, y esto es un detrimento en la salud y en la protección social, que genera un alto riesgo que las respuestas de VIH, tuberculosis y malaria, especialmente las lideradas por la comunidad, pierdan prioridad. Otro riesgo es los asociados a la integración de servicios. Esta integración al primer nivel, si bien es una prioridad del ciclo 8, existe una fuerte preocupación de que esta integración debilite los servicios especializados, diferenciados y basados en derechos, particularmente para las poblaciones claves. En América Latina, los servicios comunitarios de VIH, la programación con enfoque de género y el trabajo con poblaciones clave suelen ser los primeros en diluirse dentro de sistemas generales. Otra amenaza es la programación para las poblaciones clave con enfoque de género. En varios países observamos giros políticos conservadores que restringen el trabajo en reducción de daños, salud sexual reproductiva, educación integral en sexualidad y derechos humanos. Estas restricciones no siempre se expresan como represión directa, sino a través de recortes presupuestarios o barreras administrativas. Lo que es relativamente específico para la región es que estas dinámicas se dan en países clasificados como ingresos medios, lo que invisibiliza profundas desigualdades de epidemias concentradas. Al mismo tiempo, compartimos patrones con otras regiones, ansiedad frente a la integración, presión por demostrar sostenibilidad rápida y debilitamiento del enfoque de derechos. Para esto también vemos un riesgo, el nuevo contexto de financiamiento global que las dinámicas geopolíticas y condiciones de los donantes, incluidos los nuevos memorandos de entendimiento de Estados Unidos, reorienten las prioridades nacionales hacia enfoques más restrictivos o tecnocráticos de control, dejando a lado la equidad, los derechos humanos y las respuestas comunitarias. Quienes más pueden perder son las poblaciones claves, los adolescentes y mujeres jóvenes, las personas migrantes y las organizaciones comunitarias. Quienes tienden a ganar poder son las instituciones estatales centralizadas y los grandes actores de implementación, en detrimento de la participación comunitaria. Sin embargo, también existen oportunidades. El énfasis del ciclo 8 en impacto y valor por dinero permite demostrar que las intervenciones lideradas por comunidades son costo efectivas, llegan a quienes el sistema no alcanza y generan resultados sostenibles. Las comunidades que se organizan, usan evidencia y participan desde el inicio aún pueden influir de manera significativa en la región. En América Latina existen altos riesgos de que el concepto de sostenibilidad se utilice para justificar recortes, especialmente para programas comunitarios de prevención y de derechos humanos. Para las comunidades, la sostenibilidad real implica un financiamiento público estable y predecible, no sujeto a vaivenes políticos, marcos legales y políticas públicas que protejan los servicios para poblaciones claves y roles institucionalizados y financiados por la sociedad civil, incluyendo el fortalecimiento de sistemas comunitarios. Uno de los principios no negociables en este ciclo debe ser que no debe comprometerse en el ciclo la participación comunitaria significativa a lo largo de todo el proceso de la subvención, incluyendo la participación real en la elaboración de las solicitudes de financiamiento, protección en la programación para la población clave de las intervenciones de derechos humanos, transparencia en datos, decisiones de asignaciones de recursos, inversiones sostenidas en fortalecimiento de sistemas comunitarios. Sin participación comunitaria, el ciclo 8 corre el riesgo de optimizar presupuesto, pero perder impacto. Las comunidades no son beneficiarias, somos actores claves para alcanzar resultados y sostener los logros del fondo. Básicamente eso, muchas gracias.
Okay, thank you so much, Christian. And there is so much that we can take from you in terms of lessons learned and also how communities can prepare. But also, you preempted my next question, which I am going to address it for Eli Araj from the MENA region. And Eli, even as you come up to introduce yourself and share the regional perspective from MENA, please tell us what are some of those things that communities, even as they are engaging in GC8 processes, communities need to ensure that they protect so that they cannot be compromised even as they are engaging. Over to you, Eli.
Yes, hi, thank you, and I'm glad to be here with you. I'm Eli Araj. I'm the Executive Director of the Middle East and North Africa Harm Reduction Association, MENARA, and MENARA and MENA Rosa are co-coordinating the MENA Learning Hub. We have here with us Ms. Taline Torikian, our colleague. I'm also member of the Developing Country NGO delegation to the Global Fund Board. Talking about the MENA region is somehow frustrating, if you want, because MENA is, although we know that we are at the low prevalence of HIV, for example, but we know also that we don't know our epidemic because of the scarcity of services, including testing and early testing and other.
Yeah, Ellie, sorry, we can't hear you. I don't know whether it's just my end, but we can't hear you at all.
You can't see me? Or you can't hear me?
I can hear him well, Lizzie.
I can hear too.
Oh, perfect. Yes. Okay, great. You're back. Yes, yes. So the person, could you please move away from the channel you're in and just go to the language that you prefer? Then you can hear Eddie.
Is there anything
Carry
I
on.
can do from here?
Yes.
It's okay now? Hello?
Yes, Ellie, you're audible.
Okay, thank you, Anna. So I was saying that we as a region, somehow it was left behind since ever because of one, the low prevalence, because of also the low, let's say, political commitment from the governments of the region, and including the criminalizing laws that makes very difficult for the community to be to express themselves and to be engaged in some of the activities. However, we have in the region a kind of coalition, which is called MENA Edge Coalition for the regional networks. Which this coalition includes, I think, 3 community-led regional networks. And we have got a grant from the Global Fund from the GC7 lately. But unfortunately, the TRP recommendations freeze the regional activities, which means that some of the regional networks are at risk of closing somehow, shutting down. So this is the issue. What we're doing in this situation is that we're trying to technically support the community-led organization. We're trying also to somehow support with the support of the Global Fund and the CRG group to support them to do some activities on advocacy, to try to be more engaged in the GC8 and to advocate for their rights as well. The issue is that if we take the region in general, we see that we have mainly in Lebanon, Morocco, the main work of the civil society. We can see somehow in Pakistan. But in other countries, in some countries, the civic space is very weak, and they are also at the risk of, for example, in Tunisia, we had a group of LGBT that they left the country even because of the situation. So now, if you want, the discussion here is about also some flexibility that is needed for the GC8, especially when it comes to supporting informal group of community members of group from the community. I mean, so and you know that the situation is very bad, especially that we are witnessing an alarming new infection in the region. 2 days ago, we were discussing with the new national AIDS program manager in Syria, for example. He said that they went from 60 or 50 new cases in the year until now 270, and in the first 15 days of this year they got 10 new infections. So there is an alarming situation. There is no political commitment at the level that we want. The civic space is shrinking, and with the Global Fund and the GC8 lack of, let's say, replenishment and funding, we don't know what would happen in the region. Thank you.
Well, thank you so much, Ellie, and please also stick around. I had hoped that maybe we could answer a few questions before we move on to our next session, but due to time, I'd just like to encourage all the hands that are up to just hold on to your questions, please, and encourage our participants to continue sharing their comments and questions either on the comment section in the Q&A. And I'd just like to really thank the regional panel speakers. Am I there or did I drop out? Okay, I'm there. Okay. So I'd just like to thank all our regional speakers, because you have really grounded your discussions into real community experiences and realities. And from my end, I have had strikingly similar realities, despite the different contexts of the regions. You know, similarities around shrinking civic space, tighter resources, you know, the growing pressure for integration, but also with integration, how do we protect community gains, and also how do we protect human rights? So what also I have noticed is that all the speakers have emphasized on why early engagement in GC8 processes for communities is vital, and why prioritizing interventions that deliver value for money for communities and key and vulnerable populations are central. So I hope we have gotten motivated from this session, but I do encourage us to, keep engaging on the comment section. In support of this, we are moving on to the resources session. And we do have a short and sweet panel who are going to be sharing with us some of the available resources and opportunities that communities can engage in, either through the GC8 or even in preparation of. And I'm going to welcome our panelists in the order that they appear on the screen. Maybe we can move on to the next slide. And our first speaker for the resources session is Alana Sharp. Alana Sharp is from the Global Advocacy Data Hub, and Alana is going to be sharing with us in 5 to 10 minutes about some of the opportunities and resources that are available. Welcome, Alana.
Thank you very much. If it's fine, I'll share my screen. Okay, thank you. Okay, thank you so much for the invitation to participate. And we've already had so much great information, so I'll just be a little bit brief. So I'm here as the Global Advocacy Data Hub and to share a few resources and support to help in this engagement. So I think the most, we've heard very, very well that the grant cycle 8 planning is beginning right now. And in particular for the countries that are going to be in the first review window, the time to engage is really right now. And to me, one thing that's very important to remember is that the decisions that are made around the Global Fund about the grants for the next 3 years are made by the country coordinating mechanism in your country. And so it's unlike other funders where it's not all made in Geneva, the decisions are made in your country. And the other important thing is that under the Global Fund's policies, the CCM is required to engage with communities in the decision-making moments. And so this is a huge opportunity for everyone. But I think that making these decisions and participating in the CCM is very, very challenging. And we know that from all of our experiences from the research and so on. And so to me, I think that being able to engage in the CCM and to do strong advocacy, I think there are a few things that everyone needs. The first is just being in the room. And so that means being invited to the consultations, knowing where to go when the meetings are taking place. It also means everyone needs to understand very well how the process works. And so we've heard a lot today about what's happening, how it's going to go, but we need to deeply understand what the timelines are, how to engage, and how it all works. I think another thing that's important going into Grant Cycle 8 is being able to bring strong evidence about what has worked and what hasn't worked. So have the PRs done a good job? Have the programs been working? Have they been reaching people? Are there barriers that need to be addressed looking forward to Grant Cycle 8? And also we need to be supporting each other to help people to feel empowered to be able to stand up for community priorities, because the CCM is very challenging. There are governments in the room, there are technical partners. It can be a space that's hard to engage, and so we need support. And then of course also knowing how to escalate when there are challenges, when you're not allowed in the room, when you're not allowed to have access to materials, when you don't have access to what you need to do your advocacy, how to escalate and ask for support. And so I just want to share what we are as the Global Advocacy Data Hub. We're just a group of civil society and community organizations that are trying to support advocates in their work. And so we're trying to make sure everyone has access to information, to data, and to support in their work. And we're trying to be very responsive to community needs going into Grant Cycle 8. So some of the ways that we're here to support you, on the question about being in the room where decisions are made, if you're already a CCM member, you know all of this. But if you're not, if you're new to this, I think one of the main things is knowing who to contact and who to reach out to. And on the Global Advocacy Data Hub and the Global Fund website too, we have resources where you can look for, we have what we call a CCM dashboard, and so it's information about your country. And so you can look up your country name, and then at the very top of the page, you can see contact information for your the focal point for your CCM. And so that can be one place to start, is sending an email to that person. Another thing is, we've heard from all the learning hubs, from all the partners who can provide support. So you can reach out directly to the Global Advocacy Data Hub to help you if you're facing challenges. You can look up the contact information for your learning hub. You can also escalate challenges when they're happening on that support page. So we're here if you're facing challenges, we can work with you together. We also have, understanding when to engage. There are obviously these webinars hosted by the learning hubs and also the Global Fund Secretariats. We have a calendar where you can keep up to date about what's coming next. And then about, the other part is that understanding how the process works is a big challenge. And we've heard some of the questions today, and we always get lots of different questions. And so the webinars are helpful, but then there's always going to be follow-up questions or things that are specific to your country that you're going to need help with. And so one of the things that we're doing with the learning hubs is to create a Know Your Rights, a live community FAQ where you can look up questions and get answers to the things you need. And so we've done this in the past around reprioritization, and we'll plan to do something similar. So keep asking your questions. We'll be keeping track of them and trying to have a space where you can look up answers. And then on the point about having the evidence about what's worked in Grant Cycle 7, we have many resources about this. Going back to the CCM website, you can go down on the page, find your country's page, and there's a lot of information here, like when your funding request window is likely to be. So when the timelines are for you, you can see which grants are active in your country, when they're finished, who the PRs are if you're not already aware. And then you can also go and look at the budgets for Grant Cycle 7 and see things like who is spent, what the absorption rate is, what the activities are in the grant, and then think together about what's worked and what hasn't worked and bring strong advocacy messages to the CCM. Another thing is, the reprioritization exercise has just happened, of course, and so we have a new resource that lets you look up what was removed from your grants during the reprioritization exercise, which is, I think, a helpful tool when you advocate for Grant Cycle 8, because if big gaps were created during reprioritization, it's good to come in and say, we need to figure out how to fill those gaps, either with Global Fund resources or domestic resources. So that's all online. And then another thing is we've spoken about some of the documents and materials and so on. And a big challenge that I've heard is that it's difficult to access documents and the materials you need to do your advocacy. Sometimes they're only available to certain members of the CCM, or it's difficult, they're not widely shared. And so one thing that we're doing is if you're interested, we're trying to collect documents that have been used in Grant Cycle 7, advocacy materials, CLM data, things like this from the past so that we can all have access. And then also as Grant Cycle 8 begins, if you start, if you receive Excel documents or things that you need help analyzing and would like to share them so that everyone can have access to the same information, we're developing a platform for document access. And so we'll be sharing this. This is a space if you have things you want to share, if you want materials that you think would be helpful for GC8 advocacy, this is a new resource. And I won't go much into too much detail. I know we want to hold time for a lot of questions, but really, I think the thing to emphasize with our support is we're trying to be here to respond to people's needs. And so if there's anything you need, if you want one-on-one partnership, we can provide that. We can connect you with the learning hubs, with other civil society members, the board delegations, and so on. And we're just here for you. So I'll share all these information in the chat. Thank you.
Oh, wow. Thank you so much, Alana. That was very, very informative and also a really easy to use resource, whether it's for advocacy, engaging fellow civil societies, governments, or even the CCM. So thank you so much for availing this information to our audience. So in the interest of time, if you have a question for Alana, please share it in the Q&A session and she'll be on standby to answer it as well. And I'd also like to encourage our previous panelists to just skim through that section and see any question that may have been directed to you, and you can quickly answer in case we don't have so much time at the end of the call to answer all the questions. And now I would like to invite Rachel Ono from ACT Africa to also briefly share with us some of the opportunities that she has for all of us, that we can be able to align ourselves along in reference to GC8. Welcome so much, Rachel.
Thank you, Lisa. And I'm looking at the time, so I'm going to be very quick. I know I've been doing the Copper CA project in Africa, and so let me take that opportunity just to let you know that the Copper CA project produced a lot of resources that will be very helpful during GC8. And so we have the compendium of community guides. You can find all these resources on our website, which is the African Coalition on TB website. But today, I'm not here to talk about copper. And before I proceed, let me say good morning, good afternoon, good evening, depending on where you are joining from today. So today, I'll be talking briefly about One Health. And this idea is basically emerging, and it came up as a result of African Coalition on TB being a member of PREZOD. And for those who are wondering what all is PREZOD, PREZOD basically stands for Preventing Zoonotic Disease Emergence. So it is an international coalition working on pandemic prevention using the One Health approach. So what we are planning to do is quite straightforward. We all know that most infectious diseases do not come out of nowhere. And they basically emerge where people, animals, and the environment intersect. And very often these intersections happen in the same community where we all work. And so what this means in practical terms is that communities and CSOs are central to prevention and not just response, as we've been working on. And yet many of our current intervention remains disease-specific, which limits in sustainability and weakens early prevention. And so this is why PREZOD, together with some regional networks like ACT Africa, ANASO, RAME, ACT AP, is exploring a training of trainers or trainings of trainees approach on One Health, which will basically focus on One Health fundamental, the practical application to HIV, TB, and malaria, community surveillance, prevention, and preparedness. And so we are just looking at organizations that will be interested in these trainings, where these organizations will go ahead to cascade the knowledge to other CSOs and to communities using the local language, local examples, and existing programs you already run. And so we are not looking at replicating anything. We are just looking at the work you're doing to just run alongside with it. And so the value of this training of trainers or trainers of trainees is that it is cost-effective, scalable, and sustainable. I'm sure you'll be wondering, what has this got to do with GC8? And so this approach is particularly relevant in the context of GC8 because it directly supports RSSH. It also supports pandemic prevention, preparedness, and response. And of course, we've been hearing all the speakers value for money. So there's a better value for money through integrated cross-sectional action. And so we are thinking to begin these training of trainers end of January or early February, starting with an online regional sessions and then supporting trained CSOs to roll this out in their various communities. The aim is basically to create, as I already said, not to create a new system, but a parallel system to strengthen what CSOs are already doing. And this will basically build a long-term community capacity for prevention, because we all know that when it comes to the concept of One Health, it is more of global than a community level. So we are just trying to bring One Health into the community so that the knowledge is at the community. And so the aim is to share directions, invite reflections, and begin a conversation on how CSOs can play a stronger role in operationalizing One Health at the community level, particularly within the context of GC8. And so that will be all for me, Lisa, and thank you very much.
Thank you so much, Rachel, and thank you for even contextualizing it to GC8. And earlier we had a question around pandemic preparedness, and I believe that the audience members who are asking can now utilize your opportunity as one of the ways to prepare for GC8 around pandemic preparedness. So thank you so much for sharing that, and we hope that you are able to avail more information on the chat section. Someone's mic is on and it's causing an echo. Okay, thank you. And you're able to share that so that they can be able to see how to engage better. So moving on quickly in the interest of time, I would like to invite our next speaker. Our next speaker is Annabelle from Global Fund, and Annabelle is the technical advisor for community engagement, community rights, and gender department. Annabelle, as you have had, communities are finding ways to assert their role and be key partners and decision makers within GC8 processes. So I'm sure that even as you come to speak, they can be able to really align themselves with some of the resources, tools, and opportunities that Global Fund has. So welcome so much, Annabelle.
Thank you so much, Lisa, and everyone. I'll also try to keep it very short. I'm requesting to share my slides. I've already been busy responding to your questions in the chat, so thank you so much for those. And as Lisa mentioned, they will be tracked by the Learning Hub, so we can make sure to also respond to some more questions afterwards. I just wanted to provide some complementary information about resources and tools available for community engagement in Grant Cycle 8, because there were some questions around what to do practically as next steps to engage in funding request development and also in grant making. And we have a wealth of resources from the past, and many of them are being updated. I want to start with some of the support that is provided through an initiative in the Global Fund. It's called the Community Engagement Strategic Initiative, which provides, amongst others things, a short-term technical assistance for engagement during funding request development and grant making. So this is just a quick overview of what can be covered. We can cover community consultations to help in the priority identification process and for communities to engage during grant making discussions. And what is really important for us, given the limited funding that we have for the component, is to ensure well-coordinated requests among CCM, civil society, and community members for this support stream of support. So if you are interested in requesting short-term technical assistance, you can reach out to the Learning Hub in your region, and we will also post the website of the Global Fund in the chat that includes some more detail about the TA component. You could then discuss the approach at country level. If you're interested in requesting this, complete a request form. We will review it on our side, and then we mobilize an expert or team of experts who can accompany you during the process. What is important to note is that this support is for constituencies at large, it's not for individual organizations, but the purpose is really to ensure engagement of different constituencies represented in the CCM in the funding request and grant making processes. For us to process the technical assistance in time, we ask you to submit your request at least 6 months before the submission window that your country has selected. So for window 1, that would be now. For window 2, that would be around end of the month, and then a little bit later for window 3. We're also posting in the chat the list of countries from which we have already received requests. We have received requests from 21 countries across different regions that the Global Fund supports. If you see your country listed there, please feel free to reach out to the Learning Hub in your region if you're not connected to the process, and we will be happy to connect you with the TA requested to make sure that you are considered in the consultation process. There is a second channel of support that goes through the learning hubs. They all have budget available for rapid engagement support. So these are small grants of around 5,000 USD to support, for instance, face-to-face or virtual consultation, review of documents, mobilization of a consultant, to facilitate community consultation, or also programmatic and mentorship support during consultations. So if you have identified a key gap in funding in the upcoming process, you can reach also out to the Learning Hub in your region. Here, just the context of the Learning Hubs, you will all have them, but just as a reminder, I want to also quickly speak about the Community Engagement Toolbox. The toolbox has existed for around 4 or 5 years, and it's a repository of a lot of tools that were developed by community networks and organizations. It includes tools around understanding the Global Fund and the basics, understanding programming for community rights and gender, how to engage with the CCM, how to engage in NSP development, funding request and grant making. So it includes a wealth of resources. So we really recommend that if you are looking for specific information or community-friendly guides to the sometimes heavy Global Fund documents and guidance, you can find it here through the link on this page. The next update is planned for March, and several partners who are on the call today as well are updating tools to be included in the toolbox. For example, a guide on how to hold a community consultation in GC8, what communities must know about Grant Cycle 8, a sustainability transition and co-financing guide will be updated, one guide on service integration. And then some of you may know from GC7 that we had developed a costing tool to support communities to identify and capture grassroots costing information as an input to the funding request writing and also the grant making process. So this tool is currently being updated, and also a community guide on RSSH is under development. As a last reminder, I just want to share some ideas for the way forward and the further information session. On the left side, you see the external Global Fund information sessions. 2 of those have been completed, the overview of GC8 and the applicant material for HIV, TB, malaria, and RSSH. You can find here all the recordings in English, Spanish, French, and Portuguese, as well as the slides, and more sessions are coming up, including the session tomorrow on how to apply as core or high impact portfolio. So this session will also speak a lot more in detail about the whole process around a classic funding request, what templates to fill in, a grant ready funding request, what is the process. So if you had questions today around this, I really recommend that you join that webinar. And the next webinar next week, Monday, will be around sustainability transition, co-financing, integration, and value for money. The learning hubs are planning further joint sessions every 2 weeks to unpack from a community perspective some of the guidance for GC8, including HIV, TB, malaria, information notes. And in those sessions, we will be able to also bring in some other colleagues from the Global Fund Secretariat. So you have further opportunity to ask questions and to engage with the guidance and the information available for Grant Cycle 8. And with that, I'm handing over to Lisa.
Thank you so much, Annabelle. This was very informative, and I believe that colleagues have been able to see how better they can be engaged as communities. I do have 2 hands up that I'd like to invite in our really short Q&A session. Please, as you're asking your question, direct it either to a specific speaker and also make it short and sweet. So the first hand that we have is Paul Soa. Paul, if you can be able to unmute yourself, please ask your question.
Well, thank you very much. I think I even posted this question on the Q&A section also. There's a trend that I want us to look at very carefully, because if a PR wins the Global Fund PR category funding and recruits SRs, I think it's time we have a situation where PRs don't take so much, but then maybe put in place some kind of a structured approach that the SRs can also benefit in terms of capacity building, and then building that kind of a sustainability in the long run, because SRs are more closer within the community and they are working with the community members. The question simply asked is, when it comes to that, SRs are always restricted in their monitoring and how they manage their own project. It looks like a PR is dictating everything. PR is sending his own advisors. Sometimes it becomes so confusing when a PR advisor is dealing directly with staff of the SR on the ground. So I believe that it's time we need to look at it again. How can we motivate, encourage SR, resource SRs to be able to be more susceptible towards owning the project in their way, and then seeing their contribution as very urgent, and then even look at the future sustainability. And this is what I'm asking for, that SR needs to be well resourced when it comes to monitoring the project on the ground and making sure that the project goals and all the standards are being met, so that the PRs are only coming in to look at how SRs are meeting those standards and all that. This is all simple thing I'm asking for. Otherwise, we always have SRs going in there, and they don't really have that kind of what I call the capacity. They don't really have the authority to manage their own project, but they are being detected for somehow. This is the question.
Thank you so much, Paul. Maybe before we get a volunteer to answer that question from our panelists, let me just quickly invite Festus. Festus, please keep your question short and sweet, and if possible, address it to a specific panelist. Thank you. Okay, Festus, are you able to speak?
Okay, thank you very much. My question is specific to what is the fate of networks in terms of implementing or being engaged in the GC8, and are we ready in considering the different needs of persons with disability in our engagement from different regions? Because a lot of them would want to also participate and give their feedback, or rather give their input on some of the components. Is there a specific budget to address the issue of reasonable accommodation to persons with disabilities? Thank you.
Okay, thank you so much, Festus. Maybe I'd want to throw it to our previous speakers. Is there anyone who would want to answer Paul as well as Festus? Annabelle, would you want to take a go in either of the questions?
I can quickly respond to that question about engagement of persons with disabilities. So overall, as you know, CCM representation is really in line with the different epidemic situation in a country. And as Anna presented earlier, the importance about an inclusive country dialogue. This for sure also includes persons with disabilities. I can share, for example, that through the short-term technical assistance component that I have presented earlier, in many cases there is a deliberate inclusion of organizations representing people with disabilities. And in many countries, they are identified as a key group to be engaged. So that's something that at least from the team working on engagement and supporting engagement work, we are proactively mentioning and checking with requesters as well. But I'm also giving the point back to some of the learning hubs as well. Maybe there's also opportunity to connect with some of the organizations representing people with disabilities and discuss how they can be engaged in the grant cycle 8.
And just to add, Annabelle, maybe you can share your organization, the country you're asking from, and someone from the Learning Hubs could pick it up from there. Because usually it's very difficult for the Learning Hubs to get to know all the organizations and the people involved. But if you come forward like this, it is a good starting point.
Thank you so much, Rachel and Annabelle. The other question was from Paul around how PRs and SRs are engaging communities and the challenge of tokenistic engagement. Do we have any panelists who'd want to maybe share a response to that or a recommendation?
The organization and the country.
Yeah.
Is the question on community engagement?
Yes, and tokenistic community engagement by PRs and SRs, and how maybe to avoid that in the upcoming GC8 processes.
I think we are basically still hovering around the same thing, like the TAs Annabelle spoke about, and even sharing the information that is needed. And so I think for community engagement, the Learning Hubs are doing their best. The Global Fund is ensuring that no one is left behind. Communities are engaged. And so we also, on our part, have to make a deliberate effort to be parts of the processes that are going on. And I think the key thing would be around information sharing. For example, this webinar is a very good webinar, but if it doesn't go out there, people will not even hear about it to join. And so it is key that when we get information, we should all circulate it, especially those of us working with communities in the communities. So let's all try and help each other when there's any information. That's how community engagement can be built. Thanks.
Yeah, thank you so much, Rachel, for that. And Paul also, Alana had shared about her resource on how you can track ethical engagement of communities. You might want to also look into that. So, colleagues, we are at the top of the hour and we have literally come to the end of this amazing webinar. Unfortunately, due to time constraints, and we do not want to keep you all here waiting for too long, we may not be fully able to answer all the questions in the chat box, but I'd want to really appreciate the engagement. It has been really engaging, very interactive. Maybe what I'd want to urge our panelists today is just to skim through some of them and see which ones that they can be able to answer. Also, as Annabelle mentioned, Global Fund does have upcoming information sessions that you can all register to participate in and listen in, and maybe some of your questions are going to be answered in some of these info sessions. Other than that, our learning hubs from the different regions, Francophone, Latin America, Asia Pacific, MENA, Eastern Europe, and Central Asia, as well as myself, Anglophone Africa, we have shared our emails on the chat box. Feel free to reach out to any of the learning hubs. we are always really happy to support and help, as well as keep sharing available opportunities and resources. So I'd also want to sincerely thank all our speakers, our audience, and participants for your in-depth engagement, for your honesty, and also for all of you reinforcing the message that communities, when it comes to GC8 engagement, they do not want to be spectators, they do not want to be observers, but they want to ensure that they are actively shaping, influencing responses, planning, and engagement. So I do not want to be the one to fully close this webinar, so I'd want to hand it back over to my lovely colleague Lizzie to help us in closing it with her enthusiasm and her awesome energy. But for me, I'd want to say thank you so much. Back to you, Lizzie.
Oh, thank you, Lisa. Always good to save the best for the last, I agree. Yeah? But ladies and gentlemen, as I mentioned initially, do not be overwhelmed. Ideally, the learning hubs are going to break this information as we go. And this is not the one and only session we're having. All the other learning hubs will be having more region-based discussions. So feel free to reach out to them. And it's been an amazing 2 hours, but a lot of information, as I mentioned, will be trickling in. We'll be trying to break it down for you. So if you need any sort of assistance, we're here to help. The Learning Hubs are here to help. And of course, we're super excited about the Global Advocacy Data Hub also, that's going to have a more centered sort of information for you to assist with the GC8 application and other informations around the GF. So let me just conclude here because it's been a long day. We will be sharing more information about all the other upcoming sessions, but all in all, this is going to be a turning point. We're going to integrate, but we're also going to integrate moving forward with the communities being in the middle of these discussions. So from my end and from the ENASA team and the Learning Hub team, have a great afternoon, a great morning, a great evening, and looking forward to seeing you tomorrow at the GF information session and other upcoming webinars. Have a great day. Bye-bye.